Support for your public radio station comes from our members and from Mary Cariola Center, proud supporter of Connections with Evan Dawson, believing an informed and engaged community is a connected one. marycariola.org.
From WXXI News, I'm Raquel Stephen, filling in for Evan Dawson, and this is Connections. On this hour, we're talking about Black maternal health and the life-changing, often life-saving role that doulas play in it. For a long time, conversations about pregnancy and childbirth have focused on the medical system, doctors, hospitals, and what happens when things go wrong. But what if we shifted the focus? What if we asked, who's there to support you emotionally? Who's in your corner when you're in the most vulnerable, life-changing moment of your life? That's the work of a doula. And for Black mothers, that work can mean everything. Black women are 5 times more likely to die from pregnancy-related causes than white women. Here in Monroe County, Black babies are more likely to be born too small or too soon. These disparities are not genetic. They're systemic. They come from generations of racism, neglect, dismissal, and a healthcare system that too often doesn't see or hear Black women when they say something's not right. But this hour isn't just about the crisis. It's about the care and the people showing up every day to change the experience. And we're asking, what does true support during childcare look like, especially for Black families? What makes doula care so effective? And how do we build systems that center the needs, the voices, and the well-being of Black birthing people? Whether you had a doula, worked with one, or you're just hearing the word for the first time, we want to hear from you. You can give us a call at 844-295-TALK. That's 8255, toll free. Or you can call 263-9994. Or email us at connections@wxxi.org. Or if you're watching our YouTube stream, you can leave us a comment. Join us today are 3 guests who live this work every day as doulas. Jasmine Brewer is a program manager of the Black Doula Collaborative, an initiative through the Healthy Baby Network. Thanks for joining us, Jasmine.
Thanks for having me.
And we also have Ayana Alexander. She's joined us by the way of the Healthy Baby Network. She is a community-based doula. Hi, Ayana.
Hi, thank you for having me.
And Dr. Stephanie Hollenbach, joining us by phone, is an assistant professor of obstetrics and gynecology and biomedical engineering at the University of Rochester Medical Center. Hey, Stephanie, are you there?
Hi, thank you for having me.
Yes, thank you for joining us. Thank you, ladies, for joining us today for this conversation, a very important conversation. Jasmine, let's start with you. The Black Doula Collaborative. And what is that? And what does your work look like on a day-to-day basis?
Yes, so the Black Doula Collaborative is was birthed and housed at Healthy Baby Network. It consists of about 34 Black doulas in the Rochester community who are all community-based doulas. So there is a big difference between a doula and then a community-based doulas. At Healthy Baby Network, that's what we have, community-based doulas. So from a day-to-day basis, I come in and I receive referrals from a variety of agencies, hospital systems, whether it be the OB or someone's in that person's care. And it could be a self-referral, but I receive referrals from women in the community who are afraid to birth alone or who desire a doula. And at Healthy Baby Network, we are able to provide those services free of cost for women in the community. We have served close to 500 women over the last 3 years in that birthing space. So yes, that's what I do on a day-to-day basis.
So I wanted to jump in and ask, what is the difference between a regular doula and a community-based doula? Because you did emphasize there is a difference. Can you elaborate on that difference?
Yes. So at Healthy Baby Network, our community-based doula program is a home visiting program. So you get to meet the families, not just the birthing mom, but the families, anyone who's part of that support network with the mom and the family. You get to meet them ahead of time. Referrals come in as early as 12 weeks of pregnancy when mom's just finding out that she's with child, right? So the community part of it is going in and creating that birth plan. A big part of that community-based doula are the resources that we connect moms and families with during pregnancy. In connecting with those resources, we take some of that stress off mom's plate, because sometimes mom may not have the things necessary to bring baby home, right? Whether it's clothing, bottles, or, mom can have everything she needs, and maybe she just wants some support, closer support for her new breastfeeding journey, right? So we go in and we meet with mom several times before birth, so she can get to know us and we can get to know her, right? It's that connection and that trust that you build before labor and delivery that you really has mom prepared way more than she would be if she didn't have someone who was familiar with her going into that birth space. So another part of that community-based doula aspect is not just the trust, but the education piece, right? So when you go in and you're creating that birth plan with mom, sometimes this could be her first birth or this could be her third birth, but you get to arm her with different options that she may not know that she had, right? And then after labor and delivery, we follow up within 24 hours if mom is deciding, for postpartum care, see how she's doing, checking in with the family. And then after that, we work with the family up into 12 weeks, that postpartum period. So the big part of that community is we are women from the same communities of the women that we are serving.
Yes.
And that's so important for that connection and that trust. So that's the big difference.
Ooh, and that's, what, I just want to talk about just in general, like what a doula is, right? Because a lot of people are just probably hearing this word for the first
Yes.
time, right? Doulas are not medical professionals, correct? And they're not midwives.
No.
So who are you?
Yes. So we are
What
here.
are you doing here? I'm just-
Right. We're providing social, emotional, psychological, and physical support during that birth. Depending on the birth plan, mom may want to have different comfort measures during labor and delivery, right? Mom is there to help support mom while she's advocating for herself. But the professionals may come in the room and say, you know what? Your plan A is not working. We have to go on with a plan B, right? You and your doula have already discussed that before you hit that labor and delivery room, right? You have already talked about the different options. You've talked about medical interventions, right? You've talked about different treatments, things like that. But that doula is there as an added layer of support to really amplify and support mom's voice to make sure that she is seen and heard.
So what are some of the barriers that you see that Black moms or Black birthing people have to face while navigating this healthcare system while pregnant?
So I would say number one is voices being heard and respected. A lot of times we do find, and I'm going to let, Ayana definitely chime in here, but we do find that moms call us sometime and they say, you know what, something is not right. And I keep telling my provider, but, they keep sending me home, but I don't feel comfortable going home. Yeah. Something is wrong. I need this to be investigated or looked at a little further, So that is like top barrier, right? Just issue, not being seen or heard. Yeah. And, no one knows your body like yourself.
Yes.
So we have to listen to those voices.
Yes.
And if you do need a second opinion, we definitely advocate for you getting a second opinion. Yeah. Ayana, I definitely want you to chime in.
Yes, Ayana, tell us about some of the services that you provide, right? When you're supporting your clients, what are some things that you usually do?
One thing that I love to do with my clients is helping them learn how to advocate for themselves.
Ooh.
So I am helpful to help advocate for you, but I want you to know how to do that for yourself, because not only is it a skill that is helpful in birth, but it's a life skill that goes way beyond the birth room, right? So in regards to what Jasmine just mentioned, like knowing what your body is telling you is valid, one of the ways that I help them advocate for themselves is a acronym called BRAIN, and a lot of doulas use it, so I didn't make this up by any means. But the B stands for the benefits of whatever intervention is being presented. So, like, you ask the doctor, the provider, what are the benefits of this intervention, right? And that's usually what they lead with. So, making sure you get all of them. From there, you go on to the R. What are the risks of this intervention? So that way, you are knowing what could possibly happen that you might not want to happen. After that, you have A, what are the alternatives of this intervention? So if you're saying I should, if we're talking about pain medication, right?
Yeah.
Maybe I want to get in the tub instead to manage this pain in some warm water versus getting morphine or whatever the pain medication is. And then the I stands for intuition, and I really love this one because it's saying what I'm feeling inside is just as valid as the risk and the benefits and the alternatives. This is valid information that I have in my body that you can't give me as the provider. I've been living in this body for X amount of years, and it's the information that I have is so valid. So that I is very important. And then the N stands for either I need time to think about this or no, depending on what it is. And sometimes you can't get time. If it's an emergent situation, then that might not be available. But oftentimes, you can ask for a little bit of time to think about it because it can be very intimidating when there are 5 doctors or however many people in the room with white coats on and they have all this 50 years of education combined.
Yes.
And you might feel like, well, I barely graduated high school or whatever it is. I don't know. Their information is more valid than what I know in my body. So you saying, can I get some time to really just think about this? They'll step out of the room, and I always see the doctors are like, sure, like I'll be back in this amount of time, or you call me when you are ready for me to come back, and we can discuss this after you've had time to discuss it with your partner, with your family, with your doula. And from there, you can make a decision on what is best for you. You can make an informed decision about what is best for you.
Yeah, that's very important. Having that time to really reflect on it and to see, yes, what is best for me, and to gather your support system and make that decision. And I know you yourself, Ayana, used a doula in the past, didn't you?
I did.
Is that what influenced you to become a doula, or were you a doula before that?
So I was already getting certified to be a doula at the time. I wasn't practicing yet, but I knew that if this is what I want to do, I need to experience it from this side of it while I have the opportunity to. And it was definitely a game changer for me.
Yeah, can you take us through that? Like, how did you use your doula? When did you seek a doula? Because I know you can get a doula as soon as you find out. Like, I took the pregnancy test. I already know. Let me call my doula. Or like weeks before, right? I'm going into labor next week. I need a doula. When did you decide to get a doula? And can you tell us how was that relationship as a pregnant person?
Yeah, so I want to say I was probably late first trimester, early second trimester. And I reached out to a few people, and then you kind of get a vibe of like who works best for you, who you can see yourself trusting. And that's a really good part about the community doula aspect of what I do. It's because you can really connect to these people very easily. But with my personal experience, I found someone, and she walked me through learning how to breastfeed and childbirth education and, you know, just what's going to happen in my body. That makes it a lot less scary when you know what's going to happen. So like the stages of labor. Okay, at this point, you're probably going to, in transition, for instance, that's probably when you're going to feel like you can't do it anymore, but that's when you're almost at the end. Yeah. So when I was experiencing that in my body, and I literally said, I can't do this anymore. And she reminded me in that moment, you're almost there. Remember, we talked about this. And I'm like, oh, yeah, I am almost there. And that reminder, that encouragement helped me get to the end of, you know, pushing him out and giving birth to my son and knowing that I can do this because I did it unmedicated. So having that extra encouragement was definitely needed.
You're tough. You're tough. I know I took that epidural immediately. Like, no questions asked, please. Yes, come on in. I want to touch on you saying that you found the right doula for you, because choosing the right doula is important, right? Yes. There is do we go through an interview process? How do you know that doula is right for you? What are you looking for to find the right doula for you?
So through our program, all the referrals hit my desk first before they're assigned to the doulas, right? But me as a program manager, I have got the great time to, relate and build relationships with each doula. And, as soon as a doula comes in and they start working for Healthy Baby Network, I'm like, hey, what's you are an expert at what you do, but what are you passionate about? Are you very, very passionate about breastfeeding, which we all are? Or are you very, very passionate about prenatal yoga, which Ayana is? Are you very, very passionate with working with younger mothers? Where do you fall in there, right? And then we all have lived expertise. The doula community at Healthy Baby Network, between the full-time, part-time, and Black Doula Collaborative, is very rich. Yes. Because everyone comes from different, has different experiences. They've worn different hats. You've had a natural birth. I've had two. Someone had an epidural. So, and I'd like to touch on the collaborative meetings a little later, but for right now, I do my best at having conversations with each client before they're assigned, because I would like to know how do you see your doula? Would you like to work with someone who's a little closer to your age, or someone who had a natural birth? I do ask those questions because it is very important. Although I know for a fact that they will be in great hands with any of the doulas, I do try my best to try to pair them with someone who is compatible, because that makes a difference. It really does.
Yeah, and as a doula, did you ever have a client where you're like, maybe you may want maybe you send that birthing person to a next doula? Maybe that wasn't a good fit for you.
Not really, okay. Honestly. The people that come through our program, like my first meeting with my clients, I always tell them, like, you can let me know how this feels for you, because at the end of the day, this is a very intimate experience. Mm-hmm. So if you tell me, Ayana, thank you for coming, but honestly, girl, I don't really want you in that room with me, I won't take it personally, because I understand that that's a sacred space. And if I can't, I'm honored to be there, but I also won't take it personally if you decide, I just want my partner in there, or I just want my mother in there, or whoever it is. But no, my job is to be the doula that you need me to be. I don't care if you want an epidural soon as you get to the hospital. I'm okay with that. I'm not going to say, well, you shouldn't get an epidural because I did a natural, so you can do a natural too. That's not my job. Yeah. I'm going to help you get the birth plan, help you try to accomplish the birth that you want to happen. And if that's an epidural on entrance, then I'm going to be supportive of that. Yeah. So, I'm really open to my clients being whoever they want to be and whoever they are.
I love that. So I know giving birth is such a beautiful experience, right? Mm-hmm. But there's some challenges that may occur, right? Are doulas trained to handle the unfortunate circumstances where a mom's blood pressure may spike, or baby is breached, or do we know how to coach the mom through these challenges that may occur?
Absolutely. So during community-based doula training, a variety of topics, A to Z, they're really gone through very thoroughly, the training. But although doulas are not medical providers, we know the other side. Very educated on what to look for, right? Mm-hmm. So if a mom has preeclampsia, before the doctor may come in and say, we're seeing signs of X, Y, and Z, we see those signs as well, right? We're in there, we see it in real time, right? Not just from reading it. We are trained to provide support around mom's decision as far as her care. Like, your provider is going to come in and talk about X, Y, and Z. We have those conversations. That way, we can always still our mom with support and education on, or answer some questions that she may have. Yeah. Like, I'm kind of scared my blood pressure is going up. What happens after this? No one can say what's going to happen next, right? But just to be able to give her some type of insight and support around what she's experiencing right now, and letting her know, birth is tricky. Every experience is different, from person to person, from birth to birth. I may have a totally smooth sailing birth this time, right? the next time I may have preeclampsia, right? You may be considered high risk after that, but the next time it doesn't mean that I'm going to have preeclampsia, you know? But just to answer your question, yes, we are trained to identify and then support from that space to help mom make an informed decision on what's next.
Okay, and I want to bring in our medical professional on the phone, Stephanie Hollenbach. Stephanie, thank you for being so patient. As far as doulas, as a physician, what do you see as a benefit of having a doula present or involved in a patient's care?
Yeah, it's so nice to have that kind of continuous labor support in whatever format that is best for our families. And so doulas are such a critical piece of that. And it's so nice to see that be part of it. And when we look both in the experience of caring for patients, that's such a rewarding experience to have that collaborative and continuous support for patients. But then additionally, too, when we look at what the evidence shows us, we also see that there are both like concrete medical benefits to having that continuous labor support, and there's also more reported satisfaction with patients' labor. And so in so many ways, this is such a comprehensive way to be able to support our birthing people.
And Stephanie, I just want you to elaborate on that, because that's interesting. You said the medical benefits of having a doula present. Can you speak on that a little bit more, and what have you found through research and your experience?
Yeah, and so when we look at what's now a growing body of evidence, because there's great interest in how we can best support our birthing people during the labor process, and when people have looked at all of the different ways, including doulas, where you can provide continuous labor support in addition to the support of the bedside nurse and the medical care team, that continuous personal labor support has been shown to be associated with shortened labor, and decreased need for medications and fewer operative deliveries. So there's a lot of benefits there. But in addition, and kind of in a parallel track and equally important, is the fact that when we survey patients about what their labor experience was like for them, they also report more satisfaction.
Nice. And have you seen an increase, I guess anyone can answer, an increase in moms, Black moms, asking for doulas?
Absolutely.
And what are you seeing here? What are they asking? They're walking in like, hey, I need a doula now. And what is that looking like for you at the collaborative?
So we definitely see or hear from more mothers, self-referrals, because you can get referred from a hospital system, right? And a lot of the, kudos to our hospital systems in Rochester, because they do a fine job with connecting moms to our services. They may tell mom, hey, have you heard of a doula? And a lot of the times, it's becoming a lot more of the norm, which I'm so happy about, because I believe every woman who is birthing deserves a doula. But we are definitely seeing more moms interested in knowing, she just knows she needs a doula because she sees the news, right?
Yes.
People are reading about the facts. So moms are reaching out saying, hey, I'm going to be giving birth and I need a doula. I don't know why I need a doula. Sometimes I have heard, I don't know why I need a doula, but I need one. So can you tell me more about that? And I'm always happy to share. Oh, absolutely, you do need a doula. And I'm going to tell you why you need a doula. So we are definitely seeing an increase in interest. And, when we speak about community and community-based doulas, part of the reason why we do everything that we do is to educate not just the birthing people now, but the ones in the future, right? So the doulas or moms who are working with doulas, they then go on and tell a family member who's pregnant, hey, reach out and get yourself a doula. Mm-hmm. So we are definitely changing, or I would say having a positive impact on our future babies who aren't even thought of right now. Yes. Because when you're educated and you have such a great experience, you want to share. And that's part of that community part, is making sure we're taking part of the community as far as each one,
yes.
right?
Yes.
From the experience.
Yes. And Stephanie, I know Jasmine just said they're getting a lot of medical referrals, right? Stephanie, are you referring your clients to doulas more often now than before?
So I think overall, we're really trying to increase that kind of communication there and make sure that our patients are aware of the resources that are in support of being able to access doula care and other kind of support strategies with the community. And then kind of in tandem with that, because we've been able to kind of increase this collaborative work, we've also been doing a lot in our hospital system as well to be able to invite doulas into the conversation on how we kind of work together on the labor floor, including things like, doing simulations for OR care together with our doulas to be able to further streamline the process of that collaborative care in the hospital.
And I'm pretty sure there's some boundaries that are set, right? Because if you're in the hospital with a medical professional, a OBGYN, and you're a doula, and you're trying to advocate for your client, there's a point where you're trying to like, hey, wait, no, I know what's best. And is there some tussle back and forth? What does that look like?
No, I think everyone's there for the same purpose, to make sure that mom is safe. And that a healthy baby is born into a safe environment. So as doulas, we know our roles and we respect the other roles in the room. And our part of our role is not to really directly speak up to medical providers, right? Mm-hmm. It's more so that we can help inform and advocate with mom by supporting her about lifting her voice, mm-hmm. right? We never want to take her voice away from her. So, sometimes mom may say, well, can you say that? And you say, no, let me tell you how you can get that message across. Let me help you in that area. So the support looks different. But what I will say is what I find in the rooms, because I go out and I assist clients as well, I'm a doula as well. I find... And we have come a long way as far as like nurses, medical providers, and doulas in the room. I find that everyone works in harmony. We really do for a majority of the part. I will not say there aren't some situations where you kind of feel uncomfortable or maybe someone else, their energy, it seems like they're uncomfortable. But for the most part, we are there for mom. Mm-hmm. So at the end of the day, the doula is going to come in here and support exactly how we need to. And we will not... we're mindful of making sure that we don't get in the way of mom having a great experience with her care team as well. Mm-hmm. Ayana, please chime in because you're in the birthing space as well.
Yes. Go ahead. Yeah, go ahead. You can go ahead.
What was the question?
The question is like in the labor room, right? Just that dynamic, those
like
boundaries. Yeah, those boundaries that must be set.
What Jasmine said, I also agree with. Like, it's not, more often than not, it's a very welcoming environment. The providers are, they're asking me my opinion. What do you think about this? What position should we try to get her into? So they're very open and welcoming and fostering a great environment most times. Mm-hmm. And then me as well, like, I know that I'm not medical, so I'm not going to be like giving advice. I don't have the scope of, like, it's beyond my scope of practice. Yeah. So I stay in my lane, but I also have my client, like you said, I'm helping them amplify their voice, making sure that they know that their voice is the most important one in the room. And you can say what you feel, say what you need to say. And like I said, sometimes it takes that time that you need to ask the doctor or provider, hey, can I just get a few moments to think about this, so that you can figure out what is your voice, what do you have to say, and then you can say that and communicate that clearly. But I'm not like, you should do this and don't let, like, it's really, because I don't know what's best for you. You know what's best for you. Yeah. I can give you the information that I know, and then based on what the doctor has also said, you make an informed decision for yourself. I don't want to like persuade you and point you in any one direction, because you know what's best for your care.
Yeah. And Stephanie, I just want to piggyback off of that from your perspective. Do you see the medical field becoming more open to working with doulas, alongside doulas?
I do think so. I think both because it's becoming more of a practice, which then means that the more opportunities that we have to collaborate together, the more we get to know each other and get to know everyone's contribution, which always just makes that collaboration and teamwork work better. But also because, we each provide a different lens to the birth experience that this person is having. So while I had, my team may have the medical background, we haven't had the opportunity to visit with this patient in their home and learn about, their risk tolerance and their goals and values for their birth experience, and so we each kind of have a different lens to what's happening for the birth, and makes it very collaborative when we can work together. And the more we can do that, the more kind of streamlined that process becomes.
Yeah, I can say that doulas become besties, right, with your clients at some point, right? Like, you know everything about them. So that's always great to have like a best friend in the room with you. So we're gonna just take a quick short break, and then when we get back, we'll have more with our guests. We're talking about Black maternal health and the role of doulas right here on Connections.
Support for your public radio station comes from our members and from Lakeview Organic Grain, supplying certified organic feed grains and crop seeds to Northeast organic farmers. More online at lakevieworganicgrain.com.
This is Connections. I'm Raquel Stephen, filling in for Evan Dawson. This hour, we're talking about the role that doulas play in Black maternal health, from the delivery room to the wider fight for reproductive justice. My guests this hour are Jasmine Brewer, Program Manager of the Black Doula Collaborative at the Healthy Baby Network. I also have Ayana Alexander, a community-based doula, and Dr. Stephanie Hollenbach is an assistant professor of obstetrics and gynecology and biomedical engineering at the University of Rochester Medical Center. Thank you, ladies, for joining us. We actually did receive an email from a listener, and his name is Alex, and he's in Rochester, and he says, as a new dad, having a doula support my wife and I was invaluable. Can't recommend it enough. While Rochester's own Senator Samra Brook led the fight in getting doulas covered by Medicaid, this leaves parents with employee health plans to pay nothing of Medicaid enrollees in other states. Georgia, Louisiana, and Texas have some of the highest maternal mortality in the country, and not coincidentally, some of the highest number of Black adults enrolled in Medicaid, 40% of Georgians, roughly half of Black Louisianans, and 1/4 of Black Texans. These are states whose majority vote conservatively and for candidates who cut Medicaid discriminately. Statistically speaking, Black adults in these states do not vote conservatively. How can federal legislators more effectively fight to expand Medicaid when the data overwhelmingly shows whose lives are lost by a lack of doula coverage? He said, I'm sorry for the rant. I'm not. Thank you, Alex. And we know, and big shout out to my girl, Senator Samra Brook, and her fight for Black maternal health and Medicaid coverage, right? Big congratulations for having doulas being covered on Medicaid. Is that why we're seeing such an increase in people wanting doulas? And what can you tell me about that coverage? Any of you?
Healthy Baby Network, we're really separate from what, we are definitely in support of everything that's going on right now. We actually were tabling at her baby shower recently. But Healthy Baby Network, we are a non-for-profit, and all of our doula services are covered. So we actually do, are free of charge.
Yeah. Okay.
Yeah.
And Dr. Hollenbach, over at URMC, are patients now with this Medicaid being covered by Medicaid? Are we seeing that patients are requesting doulas more often? What are we seeing here as far as the dynamic between Medicaid and doulas?
I definitely think that there's such a critical piece that access plays to helping people access the services that they want and can benefit from. And so it's so great to be in New York, where we have been able to have all of our Medicaid enrollees be able to be covered for doula services at no cost since just about this time last year. And I think that's one of the pieces that really helps us drive our access to this. And I agree with those kind of very strikingly poignant statements brought together by the person writing in, that we are so lucky here to have this resource, but it's something I would love for us to see advocacy for, to really make sure that access can become more universal.
Yeah, we know having doula care, Black maternal health, is somewhat of a public health issue, right? But it's also like a justice issue. How do we make room for both?
So I think when we're speaking of justice or addressing issues about Black maternal health, one thing that we value at Healthy Baby Network is hearing directly from the community that is served. And that's how we go about addressing injustice or like any barriers that are going on in the birthing space. You have to listen to the body of people it's happening to, right? You cannot think you're going to get correction from people who do not feel those disparities, yes, or have those experiences, those lived experiences, or connected to it. You cannot be so far removed from it or do not know about it and provide corrective action, so we do value with all of our services that we provide with listening to parents first. That's why we do surveys. That's why we go back to the drawing board and say, how can we make this better? That's why we have those conversations. So that's invaluable to us. Teach us, tell us, show us, so we can help make those corrections or, help dismantle some of those issues.
And I Stephanie, I wanted to ask you, with the, federal cuts, a lot of times, a lot of cuts, federal grants are being cut. Are we concerned at all that something can happen to healthcare and how the grants can affect Black maternal health?
Absolutely. We are already at a place, even before the kind of most recent round of federal changes to coverage, may start to be making an impact, where we already knew that our rates of maternal morbidity and mortality were too high. And then when we, on top of that, start to dismantle our ability to do research into how we can dismantle inequity, when we start to take away our ability to improve universal care so that people can take great care of their health prior to a pregnancy and enter as safely and healthy as possible to improve the chance of having good outcomes, to understand how we can best care for patients and get them good access during their pregnancies and beyond. All of those things were places we already had so much work still left to do. And now when all of these grants and other kind of universal strategies of coverage are starting to be stripped away, it worries me that we're only going to see those disparities becoming worse now, when we've been working so diligently to try to start to kind of reverse that tide. But we're looking at some big barriers here.
That's a whole show on its own.
Yes.
I know we have someone on the line. We have Lisa from Rochester on the line, a caller. She would like to make a comment or talk to our doulas. Hi, Lisa.
Hi. I'm really enjoying the show. Thank you so much. I'm so concerned because, first a comment, then a question to see if we could do something about it. But Rachel Barnhart, the legislator, just published a pretty comprehensive study showing pretty inconclusively that Monroe County DHS is slow walking benefits to people, and it's really hurting people. And particularly now, I wonder if there's anything that this group can do to try to get them to do better by the people in need around here who often paid for these benefits.
Oh, thank you, Lisa. And the benefits that you're referring to, can you elaborate on that? These benefits.
Rachel Barnhart just published. It's a pretty elaborate study that shows pretty conclusively that Monroe County's DHS is slow walking all kinds of benefits. If a senior gets too much pulled out of their Social Security check in advance of from paying for Medicare, or the Medicaid part of their Medicare that they already bought, if you try to get that money back, it's almost impossible. You end up waiting over a year to get any overpayments back. And most seniors are kind of stable, but this is going on across the board with DHS of Monroe County slow walking payouts to people. And it's hurting people, and I think it's accelerating the homeless crisis.
Thank you, Lisa. Ladies, have you had an experience with DHS and the work that you do as doulas? with your clients?
The only part of DHS, we do not work directly. We support moms if they have to maybe fill an application out, right? But as far as the barriers or the things that are taking place at DHS, we are not part of, those meetings and things like that. The doula from our space, we're here to support mom, and if support around DHS in our agency, it would be letting her know what's available and maybe supporting her while filling out an application or doing some follow-ups or finding who's your caseworker, things like that. But as far as the bigger part of that, like decision making and that, on that level, we do not. Sorry.
Anything you want to add, Ayana?
No.
No. No. So, I want to ask a very broad question. What changes do you think we would see in our community if every Black birthing person had access to a doula? I know it's a good question when they say,
Yeah, it's a great question because, so when you say, what changes, we have seen changes in our community. We've seen lower C-section rates. We've seen higher breastfeeding initiation rates. Our program, out of all the women, almost 500 women that who have came through our program in birth, we have a 98% breastfeeding initiation rate.
Wow.
And that's from education and support from the doulas and the services that they are providing. That's from going into the homes and saying, hey, let's do that birth plan. Have you breastfed before? And sometimes we hear those stories like, no, I've never seen anybody growing up, breastfeeding. So it's not the norm. Okay, but we were doing this, a whole nother segment could be our history of breastfeeding, but I won't go there. But I'll just say that as far as changes, we are seeing lower C-section rates, less medical interventions. And that speaks directly to the education and informed care and support that's being provided through the doula services. So what I project, I'll give a little quick story, just my own success. My mother breastfed, right? She breastfed me. I breastfed my son. I did not breastfeed my daughter. But just from breastfeeding my son and then, becoming a certified lactation counselor before COVID, during COVID, I was doing Zoom meetings with moms that I would be meeting with. And from my son's 17, but at the time, he was like, you know what, when I get married, I want my wife to breastfeed my baby. That's from hearing about the facts, So just giving that example, because when you educate and then you model, it makes a different trend in the community. So that's what we're projecting to see. We're going to continue hitting the ground with our boots and doing the work we're doing, no matter what's going on. Support is always going to come from us. Education is going to come from us. That's the space we're speaking from. And so we're definitely looking forward to seeing less medical interventions, less C-sections, healthier birth weights, and more of a, it's totally up to mom's choice. But if you want to breastfeed or you don't know about breastfeeding, we are here to support. And we know that it's the best option for baby.
I want to talk more about the relationship after birth, right, with your client. Because it doesn't end in labor and delivery, right? I can still call you up like, hey, girl, can you come help me breastfeed? Yeah, can we talk about this relationship after birth, and when does this end? My doula is always going to be there.
So our program, the home visiting aspect of it, ends at 3 months, 12 weeks postpartum. And I have my clients, they call me for everything. Like, they're like, hey, because like you said, a friendship is formed. There's trust there. So like, hey, this is happening. What should I do? Or like, is this okay? And sometimes I have to say, well, call your provider and tell them that. And they're like, oh, okay. Like, if I'm just telling you to call your provider, but they're like, oh, thank you. Or sometimes it's just they're calling me to tell me how they're feeling right now. Yeah. And I'm just a listening ear that they trust, and they know I'm going to just listen to them. And that's all they really need postpartum. But yeah, we go into the homes. We help them with breastfeeding. Sometimes I'm holding your baby so you can have your hands free for a second, because you're just sitting there with baby all the time and you just want to have your hands free to do whatever. But our home visit might consist of me holding baby and, talking to you, or it can look like a wide variety of things. But just having someone come and lay eyes on you postpartum can be life-saving within itself. And that can be like medically, like, oh, these are the red flags that you should look for postpartum. And that might be something that comes up, or just so that they can hear how you're feeling and look at you and say, you got this.
Yeah.
Or here's a referral to someone that can help you get some extra help if you need it. So it can look like a wide variety of things depending on what that particular parent is going through.
Yeah, so you're not babysit, so I can call you to babysit when if I want to take, if mom and dad wants to go out, can I call my doula?
And there are doulas that do that. Our program doesn't do that, but there are doulas
Okay.
who do like overnight postpartum doula care and things like that. So it depends on who your doula is.
And I want to add, dads, I'm so happy that the father came in,
Yes.
called in or emailed in, I'm sorry, because the community-based doula part, we are definitely in support of that as well.
Yes.
So sometimes during those visits, the prenatal visits or postpartum, dad is like, hey, where do I fit in in the birthing space? So it's really cool to really get that relationship with the partner before labor and delivery as well, because you can show him some comfort measures, some things that he can do to really relax and help support mom, because dads do not always know what to do in that space. Or sometimes, during that postpartum period, dad is like, okay, I don't want to aggravate her or annoy her, but what can I do to support her? Okay, she's breastfeeding, so, I don't have to breastfeed the baby, so how can I support her? Dad, you can rub her feet. You can, just be there while she's breastfeeding. Or, sometimes just adding that extra pillow. Hey, baby, you need a pillow. Giving her a glass of water, some snacks. Dads definitely are value in that space. So I'm so thankful for him emailing us and just speaking of his experience, because we definitely in our program encourage dads to come on and, hey, we need to educate you too, or ask questions as well, because we want to inform you too.
Yeah, that's a great topic in itself, having that support for fathers. Because I know when my pregnancy experience, my son's father was having all the symptoms, the pregnancy symptoms. He was eating everything. And I'm like, who is pregnant here, right? So dads go through postpartum as well.
Yes.
Right? Postpartum
Yes.
experience, like they do go through this. So having that support for dads are great. And I want to ask you ladies, is there a moment in your career where being a doula, you just like, wow, this is why I do what I do?
Every birth.
Listen, that's my
fair,
answer.
Ayana. That's not fair.
Every birth, because it's like, you're in the room for a while with them while they're laboring, because you're the continuous support. So when the mom's going through each contraction, I feel like I'm there with her with each contraction. I'm making sure she's okay. I'm fanning her. I'm offering her something to drink. Do you need some chapstick? I'm there by her side. And then as we're getting closer and I can like feel that baby's almost here, I'm like, ooh, it's happening again. Like I get excited all over again, as if I didn't do this 5 days ago or 2 weeks ago or whenever the last birth was. It's like all over again. I'm getting excited. I'm like in the room, like doing like my little labor dance, I call it. Like I get excited. And yes, I'm grateful. Every time it's the same experience for me. It's brand new all over again.
So how many families do you work with on like a monthly basis, a yearly basis?
I do approximately 2 births a month.
Wow.
And that can always be more or less, because if one mom goes late, another one goes early, it might be 3 births or less depending on what it is. But I get two people that are due in each month. And sometimes they're back to back and sometimes they're spaced out, but depending on, like I said, when the birth happens.
Yeah, go ahead,
I was just
Jasmine.
going to say, and that's intentional, the way our program is framed, because burnout is real, right? It's definitely quality over quantity. We're not trying to do, overload any of our birth workers, right? Because quality in that support, and like she said, sometimes someone can go early, so you might be birthing 3 times. It's an experience, so quality over quantity.
So you can get that phone call any time of the night.
Yeah.
They like to come in the middle of the night for me.
Me too.
Wow. Okay. Ladies, I commend the work you do, because a lot of people don't understand how vital, right, having that role is, especially for Black moms, right? Having that support in that labor and delivery room is critical, especially now. When you do enter that labor and delivery room space, is there do you do some type of routine to get ready, or how?
You know what? For the most part, if there's no emergency or alarming things going on, my first thing is, Mom, get your rest now, honey.
Mm.
Get your rest now. You want to rest as much as possible. Just making sure that she's comfortable and whatever we've talked about beforehand, it's all on a birth plan. So somebody may like music playing.
Yes.
She may be like, you know what, I want to jam until baby's coming. We might be having a little birth party in there. And then some mom, she's like, turn the lights off, put some rain music on, rain sounds, and let me relax. Every birthing space is different, but that birth plan is definitely important, and that's one of the reasons why we do them, to really help mom, when she's dreaming about her ideal birth.
Yes.
So, mom leads the way.
So if there's anyone interested right now that's listening and interested in becoming a doula or having a doula, how can they reach you, or what steps should they take?
Yeah, so you can always reach out to us at the Healthy Baby Network at info@healthy-baby.net, or email me, Jasmine, at healthy-baby.net. As far as doula training, community-based doula training, we are planning now. We do not have specific dates, but we are planning now to run 2 trainings by the end of this year. Our trainings are a little lengthier than most doula training because of that community aspect, that home visiting aspect, safety and all of that. But we are, keep in contact with us, reach out, because we do have some trainings coming up for sure.
And what would you say, Ayana, is the best part about being a doula?
Witnessing like a baby come into the world, like it's just a beautiful experience. And then standing next to that woman as she's transitioning into a mother is something I just can't even put into words.
And Jasmine, what would you say is the best part about being a doula?
I would say the same, that all that hard work, when mom gets that beautiful reward, that bundle, and you see dad and mom drop a tear, and you see that baby take their first breath, it's like the first time every time. It truly is.
Well, ladies, we want to commend you for the great work you do for our community and for our Black birthing people. Thank you so much for joining us on this hour of Connections. Jasmine Brewer, Ayana Alexander, and Dr. Stephanie Hollenbeck on the phone. Ladies, thank you so much for being a guest on Connections.
Thank you for having us.
This program is a production of WXXI Public Radio. The views expressed do not necessarily represent those of this station, its staff, management, or underwriters. The broadcast is meant for the private use of our audience. Any rebroadcast or use in another medium without expressed written consent of WXXI is strictly prohibited. Connections with Evan Dawson is available as a podcast. Just click on the Connections link at WXXInews.org.
Support for your public radio station comes from our members and from the Real Mind Mental Health Film Festival, Real Stories, Real Conversations, presenting films and live discussions with guests, including mental health professionals. 3 screenings, May 20th, 27th, and 29th at the Little Theater. Schedule and details online at realmindfilmfest.com.